Report.com is titled "Healthcare Parasites Are Sucking Americans Dry." And there's some just absolutely startling statistics. First of all, I want to make the point. The health insurance companies are, in most of the developed countries in the world, really unnecessary, at least for primary health care. There are, the one outlier here is Switzerland. In Switzerland, everybody has to have health insurance. All the health insurance companies are required to be nonprofits. The federal government pays for the health insurance premiums for low income and poor people, but you buy it through a nonprofit company. In pretty much every other developed country in the world, there is some sort of a national system that it varies from country to country. Taiwan is probably the purest single-payer system in the world. Germany is a far more mixed system. France is much more single-payer. England's is socialist. It's a socialized medicine in as much as, or you could call it that loosely, in as much as the government actually owns the hospitals and the doctors work for all the physicians work for the, or not, most of the physicians work for the National Health Service for the government. But in those countries, the only health insurance companies that exist are companies that either fill in the cracks for things like dental or eyeglasses, or companies that provide high-end health insurance so that, if you get sick, you don't end up in a two-person to a room in the hospital or in a ward. Instead, you get your own private suite, or you have a private jet air you back to your country if you're out of the country and you get sick. I mean, that's pretty much it. So we've got these parasites attached to our backs called health insurance companies, and they don't really pay for all our health costs. And as a consequence of that, 1 in 5 Americans right now has their medical debt in collection. 1 in 5. I mean, just think of the people on your street. 1 out of 5 houses, or actually probably more than that, because 1 out of 5 people in the United States. 1 out of 5 of the people living in your apartment building. 1 out of 5 Americans are getting phone calls in the middle of the night from bill collectors, are being harassed mercilessly, are having their wages garnished, or having their credit ruined, which makes it harder for them to get jobs in the future, and all this kind of stuff. 1 in 5 Americans. And half of Americans, this is a new study, by the way, that just came out from the Commonwealth Fund, and the links to it are all in the article over at HartmannReport.com. Half of all Americans who become infected with COVID are now, quote, struggling with medical debt, end quote. I mentioned some of the statistics out of my new book, The Hidden History of American Healthcare, Why Sickness Bankrupts You and Makes Others Insanely Rich. I just got my advanced copy. In fact, I just got a case of them. We're gonna start giving them away on the air. It won't show up in the bookstores for I think about another month, maybe 4 or 5 weeks. But it is available for pre-order and all that kind of thing. But in that book, I talk about, in fact, the opening chapter is about how the average American family is spending about $3,000 a year more on health care broadly, which includes insurance, pharmaceuticals, and doctors and hospitals and things. The average American family is spending $3,000 a year more than do people in Canada or Europe or Japan or South Korea or Taiwan or Australia or New Zealand. $3,000 a year more. Why? So parasites like, people like Bill McGuire, the former CEO of United Healthcare, who walked away with $1.6 billion, can become morbidly rich. Michael Hiltig, writing for the Los Angeles Times, talking about medical debt, he said, medical debt is also unique to the United States among developed countries. When experts from Japan and Europe were asked by the PBS program Frontline about their prevalence of medical bankruptcy in their countries, some had trouble even comprehending the question. I mean, let that sink in, right? You ask somebody in Japan, well, how bad is the medical debt problem in Japan? And their response is, what is medical debt? Honest to God? We do have 2 single-payer systems. We have Medicare and Medicaid. And we could expand either one of them to everybody in America and strengthen them so they're really good, comprehensive programs. And in fact, this $3.5 trillion infrastructure legislation that Joe Biden is pushing and Bernie Sanders is pushing actually gets a start on doing that. Because, hey, our healthcare is part of our, we have a healthcare infrastructure as well. There are 12 states right now that refuse to expand Medicaid. Every single one of them has a legislature controlled entirely by Republicans. Why? Because the Republicans are the toadies of the healthcare billionaires.